Hello, my name is Brooke Teakin, and I am a student at the University of Mount Olive, and I will be discussing with you ataques des nervios and how culture can impact care. I first came across this subject during our interview week. My friend Dr. Miriam Clark was the subject of my interview, and she described for me an instance where she was working with the patient during her residency. The patient was experiencing ataques, but Dr. Clark was treating it as a panic attack or a panic disorder, and the patient was having a very hard time with translation as the patient spoke very little English, and there was not a translator available. Dr. Clark was having to fully rely upon the patient's family to help translate for her, and it ended up with Dr. Clark not feeling like she was able to treat the patient very effectively, as ataques are not necessarily viewed as we would typically view a panic attack, as something that has to be treated. It's almost considered like a normal human reaction in the Latino community. So therefore there's often a standoffishness as far as to seek treatment for that, unless it is just absolutely warranted or affecting physically. So Dr. Clark was able to eventually get a proper translator and understand what was happening. And so then the patient was a lot more receptive to care, and Dr. Clark was able to more successfully help the patient. This impacted me because it was the fact that culture can in fact affect psychology and how we treat patients is not really something that I had greatly brought into consideration before, but definitely something now that I see that I will have to deal with as a psychologist going forward, and in the future when I do become facing patients and their care. So what is ataque de nervios? So ataque de nervios is sometimes referred to as Puerto Rican syndrome. It is sometimes referred to as Puerto Rico syndrome. Predominantly, it was first found in the communities of Puerto Rico. It translates directly to attack of nerves. It was most often seen during a traumatic life event like a divorce or a death of a loved one, a death of a family member. A person can experience an ataques. It's seen in children who have low socioeconomic standing. Individuals of low socioeconomic standing experience them a lot more frequently. Really anyone who has kind of a hard time in life is more susceptible to having ataques, and they're not seen or viewed the same way that we would view panic attack or panic disorder, as we view it as, okay, this is a issue or a problem if you're having panic attacks or a panic disorder. Ataques in the Latino community are viewed more as a commonplace occurrence, like this is a natural body reaction, and it only becomes prevalent if it is happening multiple times or is affecting your everyday life. Ataques can have comorbidities of panic disorders and anxiety attacks, and are actually very indicative that it could be a panic disorder or anxiety disorder prevalent, but ataques do not necessarily go hand in hand with panic attacks or anxiety disorders. So why is this information of great importance? So this information is very, very important when we consider how we treat patients, just because we see panic or anxiety in a circumstance, and how we view panic and anxiety in our culture does not necessarily mean that that's how it's viewed in all cultures. We When we want to elicit care has many different facets and faces, and it is very important that we take into account a cultural perspective when we're trying to help care for a patient. Ataques de nervios, there are often symptoms similar to anxiety attacks or panic attacks, but patients will have a lot more outlandish reactions, violent outbursts, deeper senses of depression than you would typically see with a panic disorder or an anxiety disorder. It does primarily affect the Latin communities. Also, in the United States, the Latin community is one of the fastest growing population. It's very important to understand how ATACs are viewed. There was a study done in 2011 where they were reviewing ATACs and new mothers, and it was found that when discussing nervios, it was a lot easier to have a conversation about emotional well-being with a new Latino mother, than using the subject or the terminology of like postpartum depression, or something of that nature, which has the implication of like a long-term neurological issue. Ataques are not seen as like a neurological, a sociological issue. In the Latin community, it's seen as just a bodily reaction, and so they were able to increase the receptivity of care in those mothers in that study, done in 2011, by just using the differentiation of terminology. This is just very important information, um, to be able to take care of all individuals from all walks of life. Having something simple like this where we view one thing differently than others may view them in their culture, can greatly impact our ability to care for those individuals. And just having the awareness that there are cultural differences when it comes to the subject of psychology, um, is very, very important. Thank you so much for your time and listening to me today. If you have any further questions, you can reach me via email.